I
Yeah.
I wanted to ask you about a couple of aspects of the differences between, especially in mental health, and um, how you might think about it. So one of the things that you and I have talked about is, you're practicing in Portland, Oregon. I'm in Syracuse, New York. So I always say to you, I would refer so many of my clients to you
Right.
if you
Yeah.
were here. And so thought it might be good to have this conversation. Well, why would I do that? You're someone might think that you're mostly treating physical illness.
Right.
Um, so I want to talk to you about what you think about that.
Yeah.
And what I would do is lots of times people who have mental illness are also physically not well. And lots of times people who are physically not well are also, if we put it in the most rudimentary terms, either depressed or anxious
Right.
or both,
Right.
or somewhere's on that continuum. They're
Yeah.
struggling emotionally.
Sure.
And then that impacts their relationships, or maybe their relationships are impacting all of that other stuff. So if I were to send somebody who is depressed, say, to you, what would you do with that?
Well, it would depend on a lot of it would depend on their the way that they present, but there's there's different things that people can uh, carry into a treatment setting that will be of benefit or not be, or be harder to work with. Um, like if somebody is depressed, for example, right? Like
Mm-hmm.
that's what we're going with. Usually, people who are depressed, not in every case, but usually people who are depressed don't have their sleep is off, right? Their sleep is off. Usually, people who are depressed don't have a solid exercise regimen, right? Some people do, but a lot of people don't. So, part of what I would do with anybody like that is I would work on the cycles that are implicit in being a human being first. So the first cycle that we would think about is breathing. Almost this is something that I've seen. Everybody who is depressed doesn't breathe well. I have never met somebody who's depressed that breathes well. So the first thing that I would look at, part of my initial evaluation with somebody, as you know, I do a lot with the pulse diagnosis, and I feel the pulse for probably a minimum of 30 minutes. And in Chinese medicine, we have different methods of diagnosis. One of them is by feeling the radial pulse here. We can feel the different qualities of the organ systems and some of the qualities of someone's mental emotional state. We can feel traumas that have happened in the past. Not everybody can do that, but there are some people that train specifically to be able to do that. The lineage of pulse that I practice is one of those that tries to do that. Um, and so that's one of the things that I'll do. I also pay attention though to a person's breathing, to the sound of their voice, to certain qualities, certain features on their face, their tongue, and their ear. Um, and breathing is a huge part of the somebody's health and well-being. So, like, there's things that you can do to help a person. So let's say the person's depression manifests as they feel tired and they feel fatigued and they feel sad and they don't know why. Okay. And specifically when I ask them about that, they feel it right here. Like, this is where I feel that. Some people it won't be that way. Some people will be like down here,
Mm-hmm.
or it'll be like in their shoulders or in their not their I'm not touching my shoulders, but in their like neck and
Mm-hmm.
their spine even.
Mm-hmm.
Um, that is important to me because that means that there's something happening there that I can that is my way in to influencing what's going on. So we tend to think in the modern day that the brain has all of the memories and all of that stuff, and that's fine. That's true to a certain degree, but the experience of the nervous system is felt in the body. So if I am to understand the connection between the body and the mind, I can also influence the body to affect the mind. And a lot of the Taoist thinking is about, well, cultivation practices, Qigong and Neigong, are about the suffusion of the mind into the body. So making the mind pass through the body in a way that's easy and conductive, like a baby. A baby has a very good suffusion of the mind into the body, and that's like a prerequisite for more intensive Qigong or Neigong training. Your mind has to be able to go through the tissues of the body and rest there in a way that will, without like a lot of tension, be present in that stuff, so that there's a conductive quality that happens. And one of the problems with people in modern times is all of the stuff we do is in our heads. We go to school for all of the stuff to be in our heads. And the way that we keep our minds in our heads is by holding tension in our body. So again, we have that like
the tube thing.
Yeah, the tube thing, right? Like the reason we stay in our head, the reason we can, is because we keep our bodies tense. So if we release that tension, then our mind starts to suffuse back down. And the first thing that happens, and I can tell you because this is something that I've experienced, is when you're working on getting your mind to release back into your body, at times you feel kind of dumb because you're not in your head and you can't respond to things as quickly intellectually unless you put yourself back into your head. So it takes a while for you to be able to do both of those things. But
and some people would not like the feel of that.
Some people would not like the feel of that, and we've talked many times before about how difficult it is for certain people to be in their body, right?
Mm-hmm.
But from a Taoist perspective, being in your body is the part, like that's where the knot gets unwound.
So let me just ask you, because we around traumas and stuff like that, and you were talking about the body having memory of trauma and stuff like that. So if somebody were doing this practice and they were trying to get their mind in their body, would they then likely experience whatever way their body has held the trauma as they're trying to learn how to conduct this through?
They might experience the quality of it. They don't have to experience the thing again. So there's a whole process of dissolving. One of the ways to talk about it is dissolving. In certain lineages, they talk about inner and outer dissolving. There's also the idea of breathing processes that the Chinese word is song. Song means to release or to relax. And the breathing is done in a way so that things can release. And that is... my experience with how that works is when stuff comes up, like the emotional stuff comes up, it arises and you feel it, but it's your choice as to how you want to engage into it. And you don't need to completely experience the whole thing again, the content of the feeling, to be able to release it. It just has to be present, and you have to give it a kind of attention, like a little bit of your awareness, to be able to let it pass through.
So the way that it works in the techniques that I've learned through like more of the mental health way of doing this, whether it be the tapping or the neuro-emotional technique stuff, it's you try to get to the place where you can visualize that thing.
Sure. Yeah, you have some contact with it.
So you work towards basically, from my perspective, like you work towards telling this story, but you don't have to tell the whole story.
Right. Yeah.
Like I think the old versions of dealing with trauma, where you'd have to walk through all aspects of the trauma.
Right.
And so trauma work that I have done at other times in my career had been more like listening to the stories.
Right.
And this way of doing it is more like taking smaller, doing some, well, I'm doing muscle testing, you do other things, you're doing, the pulse diagnosis, but so for me it would be doing the muscle testing when somebody's getting caught. And so it might be like, and it is again this kind of idea where you don't treat it if you're not getting caught there.
Right.
So if you're getting caught there, let's work on this one piece. Where does that come from? You try to visualize it and then you try to clear it.
Yeah.
So it's I'm trying to draw some parallels.
Yeah.
It's just a different way.
Yeah, it's a different way to do it.
It's a different way to do it.
But it's similar in that you have to make contact with it, sort of. And then you have a process to release it, basically. The more traditional way to do that, I think, is there's less intent around it. It's more well, observation is even not the right word. It's more listening. Like that's the word that the Chinese pick. So
listening to yourself.
Listening to yourself, but listening to the first thing that you go to is always the physical part of the body, the structure of the body. So the idea is that in order to do Qigong, you have to, the first step in Qigong or Neigong is to sync the Qi. Right? That's the first thing. You always learn to sync first because that's the safe direction to go. If you're going to sync, like if you go up, there's a lot of stuff that can happen where you send everything up and you like some good stuff and some bad stuff. So it's much safer to learn to sync first. And then from syncing, then the Qi will rise. So that's the yin and yang process, right? But to sync the Qi, you have to song, you have to release. And the way that you release is to ting, to listen. So you listen in until things release. They release of their own accord, and then the Qi sinks. And then eventually, you get good at that, and then you can just sync the Qi. Like that's all one motion. You can just sync.
But if somebody were listening, they would hear the word listen, and they would think that you mean to sound.
You do listen with your ears at first, because it's hard to understand what listening. The specific word for listen is chosen because it doesn't involve vision or feeling.
So I would think it would be feeling. Like
right.
I would think that you would feel something.
Right. And you do feel stuff. But the idea is to not direct, because both vision and feeling will lead you into a world of that continues to give you content. So the idea is to be able to identify the process that's taking place and then let it unwind itself without getting swept away into it. That's like the intent of it. And then things will go back to normal. Like, just release, just, whatever. And then the Chinese, the Chinese stuff, this kind of Chinese stuff is all about the power that you generate is through song. It's not through li, which is the idea of intention or like strength in a certain position or like toward a certain end. It's through the release of those things.
It's more about the allowing.
Allowing, yeah. It's power through allowing. You could say it that way.